Thank you very much, Prince Abubakar Sankano. Welcome, colleagues from the media. And once again, I want to apologize on behalf of the Honorable Minister for Health for the delay. And then we wish to apologize sincerely for keeping you here for a while. And we do hope that such incident will be avoided in our subsequent activities. I am also reading this report on behalf of the Honorable Minister of Health, Honorable Ahmed Labin Samate. And then, as you know, we always have a daily briefing on the situational report. And it will be recalled that we did, our fourth report was there to you yesterday. And today I'm going to give you the fifth report. I want to give you first the highlights. And this is the fifth national situation report since the confirmation of the first case of the novel coronavirus, COVID-19, in the Gambia on the 17th of March 2020. I will also give you the national situation just to inform all of you and the entire country. We also have one new laboratory confirmed case recorded. We also have cumulative. The country now has a total of 3 COVID confirmed cases. All 3 confirmed cases are imported with no epidemiological link to each other. There is high partners meeting held at the UN House to discuss the way forward. That was also done. The index case is on treatment at the Medical Research Council and is responding to treatment. I gave you details of the index case. That was the young lady. And I also gave you the case of the Bangladeshi national. That was also given to you. And I will also now go to the third case, which is a 71-year-old Gambian of Upper River region, area of Numuyel, who recently returned from France, arrived in the Gambia on the 17th of March 2020 at 1:31 hours by a TUI Akifly TF with flight number TFL 458 and traveled to Numuyel. How he traveled to Numuyel is not yet clear to us, but our team are also investigating that to find out his route of travel from the airport to Numuyel. In that particular flight, there were 59 passengers were on board. According to and also the manifestation symptoms began on the 20th of March 2020. He first reported to the OPD of Basse District Hospital with symptoms such as abdominal and chest pain in the early hours of the 21st of March 2020. He was escorted to the hospital by 2 escorts who brought him on a motorcycle. He initially resisted sample collection, but sample was later collected on the 21st of March after the intervention of the PIU, the Police Intervention Unit. Sample sent to MRC at Fajara for testing on the 22nd of March. The result became positive and received on the 23rd of March. He is currently on admission. And this information came through us as a result of the follow-up we are doing and the contact tracing, and as well as the epidemiological investigation. And our investigation results revealed that 19 close contacts of in the second case, which was, we remember, we had the second case, and then these are people who are also on the quarantine. And those people are also going to be tested, including 6 healthcare workers The flight manifest also came with us and is obtained, and contract tracing has also started. We also want to assure you that information also will be available to you on time. And now, as we said, this period briefing will still continue from Monday to Friday with the stipulated time of 12 p.m. on a daily basis. I also want to give you the summary of what we have. With regards to quarantine, we have now 2 new additional people who have been quarantined, making a total of 133 people are now on quarantine. For those who completed follow-up of no symptom with travel history, and also asymptomatic with people with travel history to affected areas, they've also completed the follow-up, and there still remain 310 people. Contacts traced, 573 people. Confirmed cases, the one we have yesterday, added to the 2, now we have a cumulative of 3 confirmed cases. Deaths, we still have 1. Total tests conducted, 22. And positive test result, yesterday was 1, adding to the 2 will be now is 3. The negative test results are 19. And I will also want to also inform you that the EFHCH mortuary and Maracas have been fumigated. 12 samples were collected from the residents of Maracas, including the 3 co-travelers who are currently quarantined, and the samples are sent to MRC Gambia laboratories. Tracing of contacts of the index case is still ongoing. A team of experts, including personnel from the National Public Health Laboratory, Epidemiology and Disease Control, and the Director of Health Promotion and Education, selected to travel to URA in order to reinforce response efforts have also been taken. All health personnel who came in contact with the second case are all quarantined and had their samples collected. We're also going to give you daily situational report. We also promise you, and this will continue regularly on various platforms. And we are also in the process of having this situational report in the local languages to be relayed on radio, television, print, and as well as local and social media. We also want to continue the daily press briefings, which are still ongoing, and we also reinforce it. We also put up what we call the U-Report poll, ongoing, to assess the level of understanding and to inform the public on the COVID-19. The U-Report has been developed by UNICEF in collaboration with us, and it's just to gauge the understanding of people with regards to the information they are getting on coronavirus. Information sharing ongoing on the Minister of Health's social media pages, both Twitter and Facebook. Additional risk communication support material with messages and banning of public gathering developed. 100 clinicians oriented on risk communication. The volumes of calls to the toll-free number 1025 hotline is massive. And I want to give you a summary of the volumes of calls, the volume of calls that have been coming. Summary of calls received on 1025. 453 calls received related to reporting possible suspects. 875 calls received related to inquire on signs, symptoms, and prevention. 3 calls related to self-reporting, while 128 calls not related to COVID-19 at all, and 37 calls referred to contact tracing team for follow-up. The next steps and recommendations. All contacts of the new case to be traced, line listed, quarantined, and tested where case definition is met. We will continue with the tracing of the contacts, including mortuary attendants, line listing, quarantine, and testing of suspects and that meet the case definition. Fumigation of Bundung Maternal and Child Health Hospital and the ambulance that carried the corpse. Fumigation of Basse District Hospital, SOP for sample reporting system to be developed and implemented with immediate effect, SOP for burial to be developed and disseminated, training of sample collectors, drivers, mutual attendants, personnel responsible for EOC, that Emergency Operations Center, and security personnel on COVID-19. Specific executive directive to suspend congregational prayers should be given and implemented, and as well as enforced. The shift work of 1025 hotline handlers, contract tracers, RRT, and other EOC members. We also expand the need to expand COVID-19 testing facility to the National Public Health Laboratory, BL3 laboratory, rapid assessment tool developed and shared, refumigation of the airport and fumigation of the Public Health Emergency Operations Center will also be conducted. We also have all teams and sub-teams to report to Safety and Security Unit for security briefings and advice prior to movement. This is also something that we're also going to institute. Increase the number of handlers of MOA social media platforms. Other partners are also willing to support us in this area. We also want to recruit additional personnel for the purpose, including contact tracers and rapid response teams. So far, so good. This is what we have for you today. And to emphasize again, we have additional case yesterday, now meaning Gambia is also added on the list of countries that are reporting cases, and we now have 3 cases, confirmed cases. Thank you for your kind attention.
Thank you very much, Director, for that elaborate update. You said something very important, that is disaggregating the information in our local languages. And as you know, URR is a region which actually is affected by those who speak Sarahule and Fula. And without wasting time, we would like to start with the first version of the local language, which is because it has a high concentration of people who have been calling since in the morning, but we told them to wait for the official briefing. Now that it is officially confirmed that the Gambia has 3 cases, and this one is in a region where Sarahule language is speaking, I will indulge your audience to give me the opportunity to explain this information in Sarahule so that those who understand Sarahule can actually get the correct information. Mare moga kunyini masakunda holange marantenga yonkin sahanga kwana masakunda gara holange besigindi marantenga ko emergency yonkin sahange barenga kebe gare direct be marantenga yonkin sahantu arunga na mare muntu ka tu mo be ke jangiro be gara ko Gambia ga mo be sasa so sikki ara kunya kita bane mfati ke kes be ga giri numuyeli khirsenya na uyunga tanyere do sina bane agri Francia akije Gambia ke tubabon kaso match ata mundo nyeru agari abio be di Kenya tui ake flight abio ke nombani TFL kamona tankara segu 487 agagiri adaga numiyel mo be o maken tu hinan oro ken kiskis nyama maraga private nyama maraga passenger nya oro ken kiskis nyama ado soro be no gari dome abio kedi tankara ge do soro kabi kunyani abio bane ado kunyani abio bane so aken da toye nda joppa khaso ke tampille nya araga base loptanindi ila krosi ati gi menya ni wata ken daga ma khaso ke tampille ndo bane ila krosi kha iri atunci motonga bebe nga ko motorcycle nga ngane soro hilira atunci nga so igati wajara na igati ko wa hore mutu wala hoy abara mancha kunda gol nyangano maga so Kenya ni herentai ma ina police nu nyaaki ko PIU para nu nyaaki pour ina adia kuya nkorosi so igara korosi igara horenda hatempo mutu idaga korosi ni dengi MRC boy laboratory na nonye igara ha MRC da ida dengi MRC kaso ke tampilendo hillonya match so abida landing kaso ke tampilendo siko Kenya da tenenge ke kondo oda hido ko lenki da nanti jangiro ke waya kawa ke dima bay awama sakitendi wa korosi so Kenya na halsa mare mono hakkelen taawni ono kilun to ke jangiro ni sahaba nyai igara humbenu ko ona traité ken Thank you very much, my director, and thank you all for giving me the opportunity to explain this in one of the local languages. And now the floor is open for your follow-up questions to our director, Mr. Njai.
So I'll start. And mine is I have a few questions, but I'll ask now, and I want to put something also across on behalf of journalists. So first, my question is, why did it take the authorities, why did it take you this long to tell the Gambian people that there is an extra case? Because this case was confirmed yesterday. Why did it take you this long? And then my comment on behalf of every journalist is that, like everybody else, journalists have their sources, they have this information. Some of us had this information, this case, the third case, since yesterday. You've not seen it in any media. I'm not talking about social media individuals, but you've not seen it in any media in this country. Not because we cannot do it, but out of respect for protocols, because this is not just journalism, this is about humanity. So we want to respect the protocols, we want to respect the authorities, and we want to join all of you, all of us together as Gambians to fight this. But what is clear is that if this trend continues, you confirm results and you want to take your time and not tell us about it, you don't want to confirm, you don't want to do anything about it, I can assure you journalists will go ahead and do what is incumbent upon them. So my position is, can we work together and find a solution to this? First of all, journalists come here, the last time they were here for 8 hours. Today they were here for hours. And we don't want this to continue. No one knows when this virus is going to end. It might drag on for months. Are you going to bring us here every day and keep us here for 8 hours, for hours? I mean, it doesn't work like that. There is a lot of anxiety, there is a lot of fear outside. So if you want to do things like this, it doesn't work for journalists. And unfortunately, if this trend continues, we will break that protocol. Whatever respect we have for the protocols, we cannot go, we will not continue to respect them.
Thank you very much. Give the director, Modunja, the chance to answer, and I'll add up, when necessary. Thank you very much for your concern.
Oh, thank you. Sirif Bojan Jr. I think when I came in and I found you people here, the first thing I did was to apologize on behalf of the ministry. And if I apologize on behalf of the ministry for the delay, I think we need to understand that I'm speaking on behalf of the ministry to apologize on behalf of the minister. We know there are delays, but we are dealing with information. We have to take our time. We give you accurate information. We don't want to give you information. Tomorrow you go back and tell us again, oh, you said this, and today you are saying this. We want to be very consistent. We want to be very reliable. And our source is a credible source, and we want to maintain that credibility we have in terms of giving out health information. Yes, the delay is there, because social media, we cannot control it. Whatever is there, that's what they feel. And let me tell you one mistake that happened some time ago. The first case, they said it was a 21-year-old. That went on social media, followed by 1 or 2 points that we ended up not having that in our final report. The lady came to be 28-year-old. We got a lot of facts about it before we came to report. And when we reported, that was I would say the most credible report we had, and wherever you go, that's the information you get. But the social media report that came first gave us a misleading information about the age of that particular individual. That's the first case I'm talking about. So this is what we want to avoid. This is why we said we might have some delays, but also, I mean, the minister and the team had an emergency meeting, and the minister wanted to be here himself. And we want to give him that respect for him to come here and even read this statement for you people. That's what we wanted to do. Not that he's the one who delayed it. It is me who said, let's allow the minister to come and give us a statement. Yeah, no, wait, I'm coming. And when the delay happened, we sent our staff to come and apologize to you. When we are also working, I was with him to try to sort out certain information. Yes, there was a delay. We said we are sorry. And what we have foreseen, it will not happen again. I mean, we want to have a very good working relationship with the journalists in this country. We're saying that it will not happen. I am speaking on behalf of the ministry that these delays that has happened will not happen. We've been 12 o'clock, we're going to give you information at 12 o'clock. That's what I want to tell you. Anytime we meet here Monday to Saturday, we will definitely endeavor to be here and give you information by 12 o'clock. We are sorry for what has happened. These are human nature. Sometimes we also have to follow certain protocols before we come out with certain information. Because if you send certain information and it turned out to be false, then the problem comes back to the one who sent the message. That is where we find ourselves. But it doesn't mean that it's intentional to keep you here. It is not an intention at all, because we know that you have been our friends from the start. Health has been, I think, one of the ministries that is very close to the media. You know it, Sheriff, more than any other person. So we don't want to break that relationship between us as a ministry and the media fraternity. We want to definitely assure you that it will not happen, and we will continue to keep our relationship. On behalf of this, I'm just speaking on behalf of the minister. And then you said, you asked, why did we take, okay, I answered that question. Yeah, the working relationship, the rest assured, is even going to be sweeter. Because
May I suggest?
Yeah.
I'm sorry, guys. I know a lot of them want to ask a question, but just a quick suggestion.
Yeah, it's
this
okay.
Safety issue, because look, the protocols, WHO protocols.
Yeah, 1 meter, yeah.
All of us are exposed to this.
Yeah.
Can we have a situation in which journalists don't physically have to come here?
Yeah.
You can send speedy, accurate information on the social media.
In fact, that's what we have discussed.
I mean, personally, I don't know. You've been in and
Anyway.
out of government, I don't trust you, so, you know, so we don't have to come here all the time and all of us, you know, face this danger. So you can send,
No,
anyone
Siri.
who want to do follow-up can come.
Now, in fact, exactly that what you are saying, that's what we were discussing also. So that when we come back to you, we give you recommendation, and this recommendation we are going to discuss it with the minister, so that anything we have an official Facebook page, and we are happy that all of you are accessing our information. We'll just put it there, and you pick it, and then you publish. If you have any doubt, you can come here, have a one-to-one interview, then we can allow that. But at least, what you are saying, in fact, we discussed it today, myself and Sankano, and the team, and then definitely we are going to work on that. So thank you for that, and it's already something that is already in our minds. Okay? Thank you.
Thank you very much, Director. To emphasize, actually, we apologize for all the shortcomings. We are all overwhelmed, as you can see, and this is a global phenomenon. Even the superpowers were overwhelmed, but we are doing our part. You are partners. We cannot win this battle against Corona without your support. So bear with us. I mean, we are all suffering, and then what we'll all succeed and be happy. What you say, the issues that you raise, I mean, the government is aware, and that's why the Ministry of Information and Communication Infrastructure is involved in the National Health Emergency Team, and that's why I'm here, so that we can filter your recommendations, your suggestions as GPU. You can put it into the writing, so as you know, the government bureaucracy. But we've been getting a lot of information, you know, since yesterday. Social media, that is the banter, but we can't do anything. But we have to verify as government, as credible. We don't want to give you information as directors and after you come, because I get a different information before we came here, but I decided to wait, you know. We decided to wait until when we come here. It is important because we have to do a lot of back and forth, cross-checking. Information is fluid, and we can't do anything about it. All we can do is to take our time. You know, and we thank you for respecting the authorities, for holding back information, and even before your deadline, anytime you need information, call us. 24/7 we are here. We don't go home at times 3 a.m. So we are at your disposal. You know, don't just be satisfied with the daily briefings, but our lines are open. We are building a media center. Be rest assured that, you know, the situation will improve. What you talk about, you know, distance, you know, press briefing is something that is being prepared right now. As you can see, technicians fixing, you know, computers. We discussed that one today. So we care about you, and we apologize that you've been here. There's not even water to drink, but we hope it will be improved. So if there are some subsequent questions to ask, you may ask, so that it won't take much of your time.
Okay, just a follow-up question to you, what Sheriff asked.
Yeah. From your media organization?
Paradise. My name is Landin Sise.
Okay.
Is it that you people don't have human resources that can verify information for you to share with the media in less than an hour or just 2 hours? Because based on the information that I received, and I know most of us received the same information or similar information, that the third case has been confirmed since 7 p.m. yesterday. So look at the duration, 7 p.m. to 10 p.m. I think if you have human resources, you can share the information to us as early as possible, so that, you know, this speculation and fears in the society can be reduced. So I want to ask whether you people have the human resources to gather certain information to share with the public.
Yeah, you want me to respond? I want to take another one. Yeah, let's just take 2 or 3 and I'll respond.
Thank you very much. I am Omar Ba, reporter in the Standard newspaper. People are already beginning to worry about the fact that the ministry have not given any information about where the force of corona casualty contracted the virus. It has been an issue. Whether you have any update about that, where they contracted the virus. And if not, don't you think this is a time for bold leadership? Meaning, with the ministry, does the ministry think that we have reached a point where they should recommend for the president to declare a state of emergency, at least by imposing a sensible coffee that is both realistic and, of course, enforceable?
Okay. Can I respond to that, Mr. Omar Ba? Omar Ba. That's a very good suggestion. We're just saying that the first case, we made it very clear that she is a Gambian who went to United Kingdom for mission on the 9th, and she came back to the Gambia by barely about less than a week, and then she falls sick. Yes, we will not be able to tell you where she contracted the disease from. That will be difficult for us. But we can tell you that she was concerned, and she felt that she was also having some signs that are similar to the WHO classification for coronavirus, and she had to do self-referral. That was done. But at this point in time, we are still investigating. But that we can only know that when she's stable and she's comfortable, she sit down, then she can tell us where she has gone. The one can be able to do that. But at this point in time, she's on admission, and we have to take our time. And then all pray that she comes out okay, and then we can get the right information you want. But for now to say that where she got it from, that will be difficult for us, because we know that she might come with it, or she might take it from somewhere and go with it. We don't know. But we know that she came from UK. But we also need to find out her travel history, well before UK, where she has gone. But that can only know that we can only know that when you sit with her and talk with her. But as of now, we have to give her a chance to recover. When she recovers, then we'll get the information we want. We are here for the next few days or so, and as we get the information about each and every one of the cases, we'll get back to you on that. We'll inform you accordingly. This other one talk about human resources. We have the human resources when it comes to information. We have laboratory. We have this rapid response. We have the contact tracing. We have the surveillance, case management, and communication. It's a network. And we have to make sure that we verify each and if information comes from Upper River region, the surveillance will not sit down alone and jump to conclusion and make a conclusion and make information or provide information that to say that this is the right information. If they provide another level, team will also go from another level to verify that information. The laboratory also will get up and also go back to the records and verify, and then we come back and communicate and network. Sometimes these are the delays, but as you know, in emergencies you don't jump. If we give you certain information that is not the right information, it is you, the journalist, again, who will come back to get us again and hold us by our neck and say, you said this before, and it's not correct. And that's what we want to avoid. We want to respect ourselves. When we give you information, we don't want you to come back again and say, hey, Mr. Njai, you said this. This was not what you said yesterday. Because I know people like you are fond of doing that. You come and tell me, hey, Mr. Njai, you said this yesterday, but this is not what you're telling me today. But we are very careful. That's why we said, when we are coming to you people, our friends, we'll come back with clear information, very reliable information, so that wherever you call and knock, they will say, yes, this is exactly what is happening. Today, when you call Basse, they will give you the same information we gave you. You go to the laboratory side, they will give you the same thing. The surveillance side, the rapid response team, the contact tracing, they will give you the same information. That's what we want, so that all of you will all go and sleep. But otherwise, when we give you something wrong, it is Mr. Njai who gave us this thing, and you start calling. Sometimes when I ask it, we don't sleep. We receive calls up to 4 a.m., 5 a.m. Sometimes we are in the office here. Who knows when we live here? We just want to make sure that people are satisfied. Journalists are satisfied. And no journalist will say, we have called Mr. Jai or we have called somebody, the Minister of Health, they don't take our calls. We are doing our best to respond to information that is supposed to go to you people. But definitely be rest assured the human resources there, and then we are even getting people who are also they're less busy and they're in other areas. We in fact trying to recruit them for surveillance, for points of entry. We are trying to strengthen all the areas. That's what we are doing right now. Human resources definitely not a challenge when you come to code, but we just need to coordinate our communication. And when we also get that information also, we have to take it to the next level. The next level is who? The permanent secretary will be informed, the Director of Health Service will be informed, all the line directors will also be informed, and it goes to the minister for review, and the Honorable Minister now will also take it to the next level for information. But the technicians also will be there to act on it. That's what we are doing. You see, in health we work in channel. And the channel is not like cumbersome enough like you may expect, but it's just a way of just telling the right information, consistent information and reliable information, so that tomorrow no one will be held responsible for mistakes and so on. So we are sorry that delay is there, but I said at the beginning of my statement that we are very sorry for the delay in coming to you to give you information, but it will not happen. And in case also we have information on certain issues, we are not promising that we are going to come back to you early to give you, like for example, if it is a positive case, we don't want to give you information to say, if it is 10 o'clock at PM, we'll come at 10 o'clock or 10:30 or 11 o'clock PM. We have to go back. The next level, we say 12 PM. That's the time perhaps will be the most suitable place to give you the information. But now that we are changing our strategy, when we confirm it, before you go to bed, I'm sure when you go to the page, our different pages, you will see the information that then you can start. If you are also in doubt of that information, then you can call us for us to clarify, or you can even arrange one-to-one interview. That one we are very much open to that. Is that okay? Are you happy with my response? No, you are not happy? No. Yes, because a state of emergency to be declared. Senegal, I know you will quote Senegal. How many cases do they have? Over 40?
79. Are we going to wait?
No, I'm not coming. I'm coming. Now we are saying one of the strategies is to close the borders. There's another way of preventing the disease to enter. If it is to come through either by land or by air. That's one. That has been done. I think people should also applaud the government for that. That's one. We also have suspension of gatherings. Either religious whatsoever must also be suspended. But you and I knows it's still a challenge. How can the government come up with a state of emergency when people in this country are also not even helpful to government? Helpful to government in the sense that trying to help people now, and people are harboring selling people who have escaped from our quarantine centers. People are still harboring them, and they're in this country. People are still harboring people who came through certain routes, and they're in their houses, and they're keeping quiet. They only call us when they see certain signs in them, or when they see that they feel a bit sick and they start calling us. Is that helpful to government? Now I'm just asking, is that helpful? It's not helpful to all of us, because you don't know whom you are staying with in your house. You don't know. The person can come with a disease. But let's try to come out clearly and tell people. In the state of emergency, it has to take certain procedures. I said it here, International Health Regulation 2005, its implementation requires a step-by-step approach. You move from one level to the next level to another level. You don't not just bang on and start implementing it. Countries, that's what they do. And we are signatory to it. It's an international document. We signed for it, and we have to respect it. So when the state of emergency will be announced, we cannot say it at this point in time, but we are also monitoring the situation, and we'll get back to, even whereas also we are going to go out of this condition, we are also monitoring, and we also come back to you and say, we are okay, we can do A, B, and C. Last China did. China was going out, and they start opening shops slowly, and they start doing certain things slowly. They were also caught up by surprise. As a developed country, they were caught up by surprise. Much more developing countries like the Gambia and other countries. No health system in this world is perfect. Let me tell you this. No matter how rich the country is, they cannot also be able to meet the demands, the health demands of the population. You talk about health insurance. Who is paying for the health insurance? It is government. You talk about other facilities for population. Government takes responsibility. And it's expensive upon government to take care of healthcare service delivery. So it is people who should also help us. But we are doing our best. We will give you information, and when we reach to a level where we need to announce a state of emergency, the ministry will now advise government as to what to do. Government decision will come from the advice from the Minister on technical matters. Look at the implication of a state of emergency. Look at also whether to do emergency, look at the implication. We have to weigh it, the benefit and then the disadvantages also. So those things will happen. And when we do, whatever we plan to do, we'll tell you. In our this summary, we always tell you what we want to do. If you listen to what I was reading, our next steps. Most of the time, we were also thinking of having a sophisticated laboratory here. We are happy that in our proposal, World Bank is willing to help the Gambia to build up a sophisticated laboratory to test all types of diseases you think of. That's another step. We never thought of that. But without this plan, World Bank would not say we can support the Gambia. But we were able to develop a plan within the shortest possible time. And the plan was signed by the minister, and it was sent, and it was approved. And then now donors are even competing for it to support. That's another step. So next time you come now, we are not going to run. We used to go to Senegal for testing. MRC had it. Now MRC had the capacity and equipment. Now what we are going to do, our laboratory scientists are also on the ground, and our capacities have been built, and they have the equipment. We are going to get the equipment, have the structure, and then we just allow them to do the work. And currently, as I tell you, we have training of laboratory technicians who can collect samples. We never thought of even having our own people who can collect samples. Now today, we can tell you, in every region in this country, there are people now who are trained to collect samples. That's also another step. It's a step-by-step approach. So the state of emergency will think about it, but we will advise government accordingly. The ministry will advise government accordingly.
Did you advise for the outcome?
Yes, ma'am.
Okay, I have two questions.
From which media?
I'm from Paradise TV. And the first question is, how effective is the suspension of public gathering? Because we can still see people gathering in public, in some areas. And the second question is, what are some of the measures that you've put in place? I don't know whether you've already started doing that or is on the pipeline. What are some of these measures that are put in place to sensitize people from the provinces? Because we know there are people who believe in socializing with each other. So what are some of these measures that you have in place?
Okay.
Thank you very much, Binta. Now you got your chance. I'm not the chairman. You got your chance.
You got your chance.
I'm not the chairman, but this time I can step into his shoes. Okay, Madam Jallo. Thank you very much. This is a very important concern. We're talking about how effective is the ban or suspension on public gatherings. It is effective as long as it is a statement from His Excellency the President. It's gazetted and becomes a policy. It must be implemented. We have challenges. People are still encouraging congregational gathering, like people at the prayers or doing other things. Other people are also doing naming ceremonies, wedding ceremonies and so on. It's also happening. But it is all of us now to work together to ensure that people are lighting on that. And we are happy. Religious leaders are joining us. The Christian community are also joining us. And then last Sunday, there was no church service. And most of the mosques were closed last Friday. And we are moving on. I'm sure next Friday you will see. Because these are areas that will attract gatherings. Or the congregation where people will just go and gather and so on. We are trying to discourage it. And people are well aware of what is going on. But we're also involving the Supreme Islamic Council. We're also involving, yesterday Imam Babali also sent out a message, 10 minutes video on, from JRTS. So, and all those things are strategies to raise awareness among the population. But it is the people now who should also help us. When we say information is for A, B, and C, it is the population now who should help us now to implement in its enforcement. The chiefs, the alcalos, the governors. We have seen the mayor of KMC who sent out a message. He's asking for the police to support him in the enforcement of the statement of His Excellency. I think this is good. These are good. Even the chiefs can do that. They can write their own statement and announce it on the radio. The alcalis can do it in their villages. So we want to see that action. We are no longer talking, but we're talking about action, action, action. That's what we are talking about. You also talk about sensitization. Since we started the 1025, you can see the statistics. And most of those, people who are calling on 1025, if I tell you, majority of them are coming from the provinces. Upper River Region, Central River Region, North Bank, and Lower River Region. Majority of them are coming, meaning they are aware. But we are also using radios like community radio, the private radio station, the public radio station, GRTS, and other facilities like, governors are also doing their own sensitization using the various structures. So I think for sensitization, it is something one cannot say it is enough, but we are doing something, and we are also trying to strengthen. And we are also happy that Paradise TV also offered the Minister of Health about 2 hours live television program. You heard about it. That was a very interesting program. We want also other television program like Kerfatu have done. Other stations have done. We really appreciate. We want that thing to continue. We want that thing to, when that continues, it is the interest of all of us. So definitely sensation. We want to also be part of the sensation team now. Join us and we do it together. Thank you.
One more question and we close for the day. Yeah.
Mr. Director,
yeah.
We've seen all over the world.
Don't go. You need leaflets. We give you leaflets also. We have some leaflets. And some materials. Don't go. Yes.
Senior government officials who normally associate or travel normally go for a COVID-19 test. And of recent, not long ago, the president of the country, which is entourage, traveled to Senegal. Whereas at that time, there was COVID-19 present in Senegal. Was the president and his entourage really screened only, or they were tested medically?
I think you saw that at the airport, at the foot of the aircraft. The president and entourage were all screened, starting from the president. In fact, the president, you can see it. I can show you the pictures. He's told the sanitizer was in his hand. He was also still with regards to his temperature. And then we can only test someone that possesses the signs similar to the WHO case definition for coronavirus or COVID-19. I said it in my statement that we can only test somebody who possesses the signs similar to WHO case definition for COVID-19. If that happens, we're going to do the screening. But we've not seen that. They've not reported anything. And they are all, no, I'm coming. The president will be more than willing to be tested if there are signs. But there are no signs. There are no signs. And then where they have gone, you also need to look at that point in time, the cases where they were coming from and where they have gone also. You need to look at that. The cases where they were coming from in Senegal and where they visited in Dakar, you also need to look at that. That was also something that we also need to look at. But as far as we are concerned, and with this cooperation and support, our team were also able to carry out temperature testing and as well as also hand sanitizer. That's what has happened. And then other information will come.
No, because this is ongoing. Tomorrow is there. We have another time.
Honestly, I think this excuse, this answer, nah. Screening will come 14 days. 14 days before the sign, they have the symptom. So the message is anybody else who come into the country
will be screened.
No, the thermometer, it's not at the same.
What you are talking about?
When we have, no, hold on, let me learn. When you have fever, you have high blood, you're looking for high temperature with that thermometer. You're not looking for anything.
Do you know that somebody came to the airport and felt coughing with high temperature? The person reported himself. Because if you know you are coughing, you can say, no, I'm coming.
Many people who saw no sign,
that's
no
it.
symptom, nothing.
Exactly.
So that thermometer, it's not test, it's not screening.
No, but you cannot test.
Not confuse
No. Sirif.
Now, the press, one more question.
You cannot test people.
This is ongoing.
It's not mandatory.
Yeah, that is it. But then, no, I'm not trying. But I mean, the thing is, I think you should have said maybe this is health. So the government policy and the presidency, this is not your area. But if you want to defend that...
No, not defending.
Everybody else.
No, Sirif, anybody who comes through the airport, even those who were positive, went through the same thing.
So everybody who is...
No, I'm coming.
Let me ask you, every single person who's gone into quarantine, they saw signs at the airport.
Where do they come from?
No, it doesn't. But the cases we
they
have,
were hotspots.
From Senegal.
No, but they were coming from hotspot areas.
That came from Senegal.
The question is now, I think I'll have to close the press conference here. This is ongoing.
No,
you have chance to one-on-one interview. You have chance to invite you on your program. And tomorrow is another day.
If you want to invite me, no what happened?
So the press conference is closed for today. Tomorrow,
but
you can invite us on your program.
No wrong information, and that should not happen.
No, Sirif,
have to be serious.
No, Sirif.
It shouldn't happen.
No,
you cannot just go and tell people that okay, we screen the president. I'm nothing against the president or something. I never mentioned that here.
Yeah.
But when you want to give information, give accurate information, because you cannot tell the people I screened the president. We screen and he saw no sign. How many people are in this quarantine? They saw no sign of anything. Our case is from Senegal. We have a case from Senegal.
Okay.
When the president went to Dakar, so many people came from all over. We look at the transmission chain in Senegal.
That's it.
I am not an expert on COVID-19, but the
the
similarities I covered in and out. I covered in and out.
When did they come from Senegal? Do you know the date?
Well, Senegal still.
No, when did they?
Senegal still.
Now this is not part of the press conference. Just normal brotherly chat. Not part of the
When did they come from Senegal?
I can tell you. I can tell you.
When did they come from Senegal?
No, it doesn't matter. But I can tell you.
No, we are above 2 weeks now.
Somebody came from.
We are above 2 weeks.
Somebody came from England, a part of England where there is zero.
But it's above 2 weeks.
No Gambian family chat. So no part of the official press conference.
It's above 2 weeks. It's above 2 weeks now.
You know why I'm
so they came from Senegal after 2 weeks now. No signs.
You know why I'm passionate about this issue, Mr. Njai? Because I'm one of the few West African journalists who covered Ebola from the beginning to the end.
I know, yeah.
Inside out, every Ebola country during the Ebola. So the similarities, I know this thing. But when we give information, the thing is, where are you?
No.
Government policy.
No.
Government policy.
No, Sirif.
But if you want
Sirif, the way you are explaining it is not the way.
The president's travel time. The situation was different. It's not as high as where we
There
are
are
now.
people, I can tell you right now, I can name 2 ministers who are in self-isolation.
Yes.
They traveled before last week. I can give you 2 who are in self-isolation.
No, it's if you come for the dad, different. This time is not changing at that time. But if you came No, because if you listen to me, I'll explain to you. The time they were coming, the situation did not change. Now the situation have changed. Policy have come. So
I think what we need, so apart from this, maybe get policy, government policy makers here. Because personally, I want to ask a lot of questions, but I would ask the wrong person. This is not your. How do you even handle
I get here, I'll get it to the right command.
No, but then what means, what I was expecting.
Talents TV. Arabo Araba. Kabo talent nani, foka jitala luluka. Ninko aka kenu nyame, ni ado ni chosano le fere.